Hi, I'm Dr. Sneha Sathe. I'm a fertility doctor and I'm available at Nova IVF Fertility in Mumbai. TTC or trying to conceive. I'm a fertility doctor. For me, every day is about couples trying to conceive naturally, not being able to conceive naturally, and doing fertility treatment. So in this video, I will tell you the things that you need to know when you're trying to conceive naturally. So first of all, know your period. A normal period or a normal menstrual cycle is regular and predictable. So what do I mean by regular and predictable? A menstrual cycle between 21 days to 35 days is considered normal. So a woman having her periods every 21 days is said to have a normal cycle, versus a woman having her period every 35 days is also said to have a normal cycle. But if the same woman sometimes has her period at 21 days, sometimes at 26 days, sometimes at 30 or 35 days, that is an irregular menstrual cycle. So what leads to irregular menstrual cycles? The most common reason is polycystic ovarian syndrome. The other abnormalities that can lead to irregular periods is thyroid issues, high prolactin levels, and sometimes women with very low egg reserve when they are reaching perimenopause. That can also lead to irregular periods. The other period abnormalities are having heavy bleeding. So if you're passing clots, if you need to change multiple pads a day, or if you're bleeding for many days, this could be a sign of having fibroids or polyps or even adenomyosis. Another period issue is having painful periods. So some amount of pain, some amount of discomfort during periods is normal. But the pain should not be very severe. It should not be so severe that you can't go to work, carry on with your daily routine activity. Debilitating painful periods are abnormal periods and it could be a sign of endometriosis. So if you have heavy periods or painful periods, you need to meet your gynecologist, especially if you're somebody who is trying to conceive. The other period abnormality is having intermenstrual spotting or postcoital spotting or bleeding. This could point towards having some cervical lesions or maybe your cervical or endometrial polyp. So the second thing that you need to know is your fertile window. What is the fertile window? So this is the period during your menstrual cycle when you are the most fertile or the duration of optimum fertility. Now this depends on your menstrual cycle duration. Ovulation or release of the egg from the ovary is said to occur about 14 days prior to your next period. So if you are someone who has a 28-day cycle, you probably ovulate around day 14. If you are someone who has a 30-day cycle, you probably ovulate around day 16. Now, why is it important to know when you are likely to ovulate? If you have sexual intercourse around the time of ovulation, your chances of pregnancy improve. So it is a common misconception. Many couples feel that they should start trying once ovulation has happened. But here it is important to know that the egg lives only for about 24 hours. Whereas the sperm live for about 3 to 5 days. So it is important to have sexual intercourse before ovulation. So we say that the most fertile period or your fertile window is the 5 days prior to ovulation. If you ask me to just give you 1 or 2 days when you're trying naturally, it would probably be day 12 or day 13 for a woman who has a 28-day cycle. What about sexual intercourse? How often to have sex when you're not looking at the fertile window? What position to use? Do you need to take bed rest after sex? So all these are old wives' tales. If you are someone who is not having regular sexual intercourse, you need to keep in mind your fertile window. But if you are someone who has sexual intercourse every day or every other day or maybe twice a week, you should just carry on with that and you need not focus then on the fertile window. Regarding positions during sex, it doesn't matter at all as long as you're having sex. And after having sex, it is absolutely not required to take bed rest or to raise your feet or place a pillow under your buttocks. All that is not required at all. In fact, it's very important that after sexual intercourse you empty your bladder to reduce your risk of having urinary tract infections. The fourth point is that obviously you're trying to conceive, means you're heading towards pregnancy. Now this period is very important for you to optimize your health. You need to eat a healthy diet, you need to regularly exercise, you need to follow a healthy lifestyle basically. Avoid eating junk food, avoid eating processed packaged foods, avoid soft drinks. And obviously, since you're heading towards pregnancy, avoid smoking, avoid drinking, and definitely avoid hard drugs. The same goes for your husband as well. It is known that the husband, if he smokes or if he drinks or if he has an unhealthy lifestyle, that can have an impact on his sperm health and in turn have an impact on conception and pregnancy. As doctors, we always advise women who are trying to get pregnant and who are already pregnant to take folic acid. Folic acid is very, very important and it is known to avoid neural tube defects in the baby. So what are neural tube defects? These are abnormalities in the brain or in the spinal cord. Anencephaly is a condition in which part of the brain or the entire brain in the fetus is absent. And spinal cord defects like spina bifida or open neural tube defects. Many studies have shown, long-time research has shown that folic acid can prevent neural tube defects in your baby. So if you're trying to conceive, whether you're trying naturally or whether you're going through fertility treatment, it is important to start folic acid in the preconceptional period. The other medication that you need to keep in mind is if you are somebody who has some medical illness, like if you are hypertensive or you have diabetes or you have a thyroid disorder. So it is important that you consult your physician and your obstetrician and take medicines that are safe during pregnancy. It's important to maintain your sugar levels. It is important to have a good check on your blood pressure and have good and normal thyroid levels. Women who are diabetic during pregnancy many times have to shift over to insulin. There are many antihypertensive drugs which are not safe during pregnancy, and your doctor needs to change these drugs. And having a normal thyroid level again is important for the initial development of your baby during pregnancy. The next point, of course, is checking rubella immunity. Now, rubella is a viral disease. It's like a simple cold and cough. But if a pregnant woman gets rubella infection, to her it'll be like a simple cold and cough, but it can have an adverse impact on her baby. Sometimes we see that during active rubella infection during early pregnancy, the baby has a lot of congenital anomalies and the woman is advised a medical termination of pregnancy. And this immunity to rubella can be checked by a simple blood test called rubella IgG. If your rubella IgG is positive, it means that you are immune to rubella and we need not worry about it at all. But if your rubella IgG is negative, we advise you to take a vaccine. That is called a RVAC or rubella vaccine, and after taking this vaccine, you need to avoid pregnancy just for 1 month. So if your immunity to rubella is not present, it is important that you take this vaccine so that you don't get rubella in the future, particularly when you are pregnant. Also, if you've been married for some time, if you've never had any health checks, you as well as your partner, I would say you should do some basic testing, get your hemoglobin checked, check your thyroid levels, do an infectious disease screen like HIV, HBsAg, HCV, check your prolactin level. And if you want to delay pregnancy for some reason, also check if your ovarian reserve is fine and if your husband's semen parameters are okay. So that said, these are the points that you need to keep in mind when you're trying to conceive naturally. If you are under 35 and if you've been trying regularly for about a year and you've not been able to succeed, you should definitely see a fertility specialist. If you're someone who is above 35, you should see a doctor, a fertility doctor, if you've not been able to conceive within 6 months of trying.